Hello, Dr. Janica. How are you?
Hi there, everybody. Glad to be here.
Thank you for accepting the invitation. I'm so glad you're here talking with me about this important subject, which is our mental health.
Yeah, no, I'm glad that you had decided to do sort of a series on it. It's super relevant, super important right now. It's something to kind of think about as, the new year rolls in. We're all in this together.
Mhm.
Um, and I'll take a moment to introduce myself. So my name's Dr. Jenica Engler. I'm a licensed psychologist in the Commonwealth of Massachusetts. I specialized in training as a developmental and pediatric neuropsychologist, and I am currently a clinical scientist doing research for depression and anxiety disorders. So that's sort of my background.
Yes, thank you very much. And I'm so happy you are here so we can talk a little bit about this amazing subject. I have a few things first to say. Uh, Mental health is very important. We need to take care of ourselves. And sometimes we are so busy with our lives and doing so many things, paying attention of so many things, but this part over here is amazing. There's a lot of things going on and we have to take care of this. That's why I'm doing this series of mental health. But I need to talk to you about how this new year's impact on our mental health.
Yeah, so this year has been like no other, right? So we've never really dealt with a pandemic like this globally since like 1918, right? Most of us were not alive at that point. So New Year's oftentimes is like a good motivator for a lot of people to, try to make some changes in their lives, to do things a little bit differently. A lot of people, it's super common for New Year's to set a resolution for yourself. Oftentimes for people, they might be doing like a dry January, or they might be cutting out carbs, trying to lose weight, trying to exercise more, or for others, doing a good deed every day. Whatever that might be, that's totally okay. But I also think it's important for people's mental health this year in particular not to put too much pressure on yourselves, right?
Mhm.
Especially for those fellow mamas out there who might be homeschooling, working from home, trying to keep it all together. This year might be the year to give yourself a little extra grace and to even skip some of those things that you would normally, put that pressure on yourself, and really use the new year as a motivator to make some changes for yourself for the better. If you do want to set some goals for yourself, I think that's totally fine. As I said, if you're somebody who, feels like you can continue kind of where you're at and make yourself better, I would fully support that. But also understanding that you don't need to do that this year. There's sometimes is this huge pressure, especially with social media. Everybody is, kind of putting out their resolutions, and this is what I'm going to do, challenges, things like that. And you don't need to do that, especially not this year. Now, for the parents out there, I would say if there's one resolution that you want to set for yourself,
Mhm.
I would say read more to your kids. So
Mhm.
is one of the best things that you can do for and with your child. It's something that the research consistently shows helps promote their cognitive, language, social, emotional development, and it's a great bonding activity, not to mention a really good activity to incorporate for like bedtime, a wind down routine. So,
Mhm.
that's one for the parents out there where I would say that's a pretty reasonable goal to set for yourself, and it works not just for you, but also for your kids. So it kind of has a dual purpose there.
Mhm. I do this every night. I read to my kids. It's amazing. They loved it. And it really creates a bond. It's a special moment. And I think great memories too. They're gonna remember this forever. Like mommy was reading to me when I was little, and this is incredible. Reading in our house is an amazing experience. But let's talk about COVID, about the bad part of this year, how this impacted our mental health. It was a big moment, a big thing happening.
Yeah. So again, we're in unprecedented times. We've never really been through something like this as a nation. It's something where COVID has really hit every individual more or less at the same time, right? So, different parts of the country may have been hit initially, but we're all in it together at this point. And one of the hardest things that has happened is that our normal social support networks have been disrupted because of social distancing. So when you aren't able to have access to your normal support structures, things like your family, your friends, your community, for some people that's church or religious community, that's really hard. Not to mention the fact that all of our routines are upended as well. So you don't have your normal routines. A lot of people might not even have realized how much they really depended on routines of going to an office and going to work and getting ready and doing things and having a routine to your day. And so we've created a lot of new routines. We've also put a lot of distance between ourselves in terms of both physical, but also sometimes people, it might not feel the same communicating via phone or Zoom or however you're doing that. And so when it comes to mental health, we have been seeing skyrocketing rates of depression and anxiety disorders. Obviously some people have been dealing with relapses in terms of addiction issues. There's a lot that's going on right now, and the research is not quite up to where we're at, right? So the way research works is that we tend to look back over time and then say, oh, this is what happened. But it's really hard to have that in the moment. So, I can kind of sit here and say, well, I do depression research and I'm noticing a lot more people seem to be depressed, but that's more anecdotal, right? But there are some early research studies that are showing that this has impacted our mental health, has really, actually pushed a lot of people to get help for their mental health, which is actually great. So people are recognizing that, they want to and need to get help, which is a good thing. But at the same time, kind of we're all struggling right now. Even those who aren't struggling clinically, so I'll give you like a little bit of background on how we diagnose anxiety and depression. So if you think about any major life events that you have, thinking deaths of a loved one, births, starting a new job, loss of a job, any major life events, there's actually a normal period of about 6 months after those sort of life stressors that, we don't offer really a clinical diagnosis of, say, anxiety or depression, because it's pretty normal to get stressed out and deal with some of those big emotions after you have a major life stressor like that. So, this normal period of adjustment, about 6 months, where you can experience some of those depression and anxiety symptoms, is actually pretty normal. We don't pathologize that. We don't say that that's, odd to be having. We expect that. Once you get past that 6-month mark, if you're still having symptoms of, severe anxiety or depression, then it starts to get a little bit more clinical. Now, in terms of depression symptoms, the two main symptoms, cardinal symptoms as we call them clinically, are feelings of sadness, hopelessness, or a lack of interest, inability to enjoy things most of the day, nearly every day, for at least 2 weeks in a row. So thinking most of the time. So this is not just something where, you feel sad for a few hours, or, you're bummed out because you can't do the things that you normally do. So this is a little different. This is more, I don't even want to do those things. I'm not interested in them. Even if they were there, I wouldn't really want to do them. Or if I'm doing them, I'm just not enjoying them as much. So those are the two core symptoms of depression. And then you also have a host of other secondary symptoms for depression. Things like sleep or appetite disturbances, getting too much, getting too little, concentration issues, feelings of worthlessness or guilt, or sometimes even questioning if life is worth living. Feeling extremely fatigued can be another symptom of depression. It's pretty common. And in terms of, anxiety, that's when your worries about things, or feeling fearful that something bad is about to happen, or feeling panicky, persists for most of the day, nearly every day, for at least 6 months. And it's well in excess of, what the circumstances would warrant, right? So it's a little tricky because a lot of people are experiencing a lot of anxiety right now, which again, I want to normalize. We're going through unprecedented times, right? So if you're not a little bit anxious and worried, I would say that would be odd to me.
For sure.
But, in terms of clinical anxiety, that's when it really starts to impact your functioning. So again, this could impact your things like sleep and appetite, your ability to concentrate and focus on things. A lot of people experience anxiety physically. So oftentimes this results in kind of some stomach problems or, a lot of muscle tension, feeling restless, like you can't sit still, always having to move, things like that. And, at the end of the day, what it comes down to is how much are your emotions impacting your ability to get stuff done, to be present, to be there for your family, and to get things done around the house, self-care. If you start noticing those things being impacted, then chances are, it might be, beyond what is just expected given these really difficult times. And that could be a signal that, you might want to get some help.
Yes, and this is the main question that I would like to ask you. How to get help if you need it? Like you go to your doctor, you go to your therapist. We need guidance. How to?
So that's actually a really good question because there's a few different types of treatment, and it really depends on, the severity of your symptoms and what you're comfortable with, and also how much you can take on right now. So typically when we talk about treatment for mental health conditions, there's two main forms of treatment. One would be therapy, also called counseling, psychotherapy. Then there's also medications. So typically either of those are a good route to go. Many studies have shown actually that for mood and anxiety disorders, therapy alone, medication alone, they're about equally as effective. When you combine them, that's where you tend to actually get the biggest bang for your buck. That's where you get the most improvement in symptoms, actually, is with the combined approach. But obviously, medications are not for everyone. Some people might be concerned about side effects, which is a valid point. Also keeping in mind that not everybody gets side effects, and also the more that you anticipate getting side effects, the more likely you are to have side effects when you take a medication. The other thing with therapy is that, there's a time commitment involved. So therapy is not like a instant sort of fix, and neither is medication. It does take about 6 weeks for medication to kind of kick in usually. Therapy also can take some time. It depends on what type of therapy you do as well. Some therapy is more short-term goal oriented and some is more longer relationship based. So in terms of figuring out what you want, it comes down to a few things, your comfort level with talking to somebody about these problems versus, your comfort level of taking a medication, or if you're comfortable with both. The best first place I like to say is talking to your primary care physician, your PCP. They're always a really good resource to start off with. Now, many PCPs will prescribe antidepressant medications. And I know this sounds funny, but antidepressants are the first line of treatment medication-wise for both depression and anxiety disorders. So for most people, that's where you're going to start off with for both, and they can be helpful for both. So if you're dealing with, and it's very common to have both depression and anxiety symptoms, a lot of them overlap as well. So when your PCP talks to you, if it's something that they're comfortable with and you're comfortable with, they might offer a medication. They might also say, this isn't my area of expertise. They might refer you out to a specialist. So somebody who specializes in medication management for mental health conditions is either a psychiatrist, that's a medical doctor who did additional training in mental health conditions, or it could be a psychiatric nurse practitioner. That's somebody who went to school specifically for prescribing for mental health conditions. And then in some states in the country, psychologists like myself can prescribe medications as well. Not in the state that I live in, but in a handful of states, and increasingly more states. And the makeup of professionals might differ a little bit depending on which state you live in, but that's the main way of accessing medications to treat anxiety and depression in this country, in the US. Now, in terms of accessing therapy, you can always start with your PCP again. They might have a referral list that they can give to you. Now, therapy is a little bit trickier because There's many different types of therapists. So there are psychologists like myself, and I would always encourage you to question what credentials people have, because some people might do a lot of advertising and they might call themselves a psychotherapist, within which in some states you can call yourself a psychotherapist and have no experience, no formal training, or a life coach. There's been a lot of that, online lately, and what I would suggest is that it's a bit of a buyer beware sort of thing. So you want to make sure that you kind of do your research and you find people who have been trained and licensed to provide these mental health services, which is typically going to be a psychologist. There are also licensed independent clinical social workers, or LICSWs,
Mm-hmm.
and licensed mental health counselors, LMHCs. And then there are other modalities as well. So like marriage and family therapists, if you're dealing with some stressors in your relationships and you want to get some help for with your significant other. So that's a slightly different area of specialty. But for anxiety and depression, you're typically going to want to stick with your psychologists, ICSWs, LMHCs.
It's very, yes, it's amazing. And I would like to ask you one more question, if it's not too much to you. Um, do we have some self-help techniques to help with our anxiety or depression? Because sometimes people don't have too much money to go, and sometimes they are having like problems and what to do.
Yeah, so that's a good point as well. Is so when you do therapy, there's typically going to be a copayment each time you go. So therapy can cost a little bit of both money and time. It's something you typically do every week or every other week. And, I realized that I didn't mention this, just before, but your insurance provider, so like if you go to your insurance healthcare website, they will typically have a provider directory where you can go and you can search by mental health or behavioral health, looking for treatment for anxiety, depression, and you can actually go through and see who's in network and accepting new patients. Oftentimes, it's actually very hard to find therapists. The lists don't get updated all that often. So it might seem like there's all these, providers who are accepting new patients, and you start making some phone calls, and none of them are accepting new patients. So what I always say is that you have to go through and I make about a dozen phone calls, and as a doctor I get about 6 phone calls back, and of those 2, maybe 3 are accepting new patients. So you have to be a little bit persistent in order to get therapy. Now, in the meantime, there are some of these self-help techniques that you can do to really make yourself feel a little bit better. Your previous speaker had talked a lot about how negative thought cycles impact the brain. So
Mhm.
the brain is very plastic, which means it's always changing. So our experiences inherently change our brain over time. So when you use a certain pathway in the brain, like negative thoughts, that
Mhm.
becomes strengthened. Now, if you are focusing more on positive thoughts, that negative thought neural pathway actually will get pruned away. So it will become weakened and you're less likely to have those thoughts. There's also this thing called the brain's negativity bias, where if 9 great things happen to you during the course of a day, there might be one bad thing that happens, but what do you remember at the end of the day? It's that one bad thing. So one self-help technique that a lot of people find a lot of success with is practicing gratitude. Now, that might look a little bit different depending on, what you prefer. So some people will actually keep a gratitude journal where they will write down all of the things that they are grateful for, all the good things that happen, and then they can reflect over that. So something where you keep a log, you can kind of reflect over that at the end of the week, at the end of the month, whatever it might be. Others might like to, wake up in the morning and say, this is what, I'm thankful for, something along those lines. Or before you go to sleep, recognizing, the good things that happen and what you're grateful for. Gratitude can be really helpful for both depression and anxiety in terms of, clinical treatment. It's catching the positive is an aspect of many different forms of cognitive behavior therapy.
Mhm.
Uh, the other thing that is very relevant right now is there's some research that shows that smiling more actually can improve your mood.
That's awesome.
It's a little hard because smiling is a social action, right? So typically we don't just walk around the house smiling, right? It's
Yeah.
something we see somebody else and we interact with them and then we tend to smile. So the fact that when we're interacting with other people right now, we're masked.
Oh, yes.
So for a lot of people, you're not necessarily smiling under that mask. And if you are, it's a little bit harder to see it, but
Yeah.
just the act of smiling more. There's this theory called the facial feedback hypothesis that's supported by research that shows that if you smile more, it does help to lift your mood. It's not going to lift it all the way, but even when you're unhappy, if you force yourself into smiling more, it can help lift your mood a little bit. Now, in terms of anxiety, there's a lot of good relaxation techniques that you can do. So one that I like to practice a lot is called diaphragmatic breathing.
Mhm.
And other people will sometimes call it belly breathing. So when you talk to kids, you say, we're going to do some belly breathing. It can also be, you can teach your kids this with blowing bubbles is a really good example. But if everybody wants to kind of join in, I can kind of take you through how to do diaphragmatic breathing. So you take your hand and you put it at the very top of your rib cage, right above your stomach. And then you take a deep breath in through your nose. Oh, that's good. Perfect. In through your nose for a 3 count. So, and then pause. And then you blow it out through your mouth for a 4 count. So you should be able to feel your rib cage moving up and down as you do that. So I usually say to do about a 4 count of those, and
Mhm.
that can help you in that moment pause and reset and relax. And also when we get anxious, we tend to hold our breath. So
Yeah.
it's really important to focus on your breath work and your breathing when you're feeling really anxious. Another technique that I like to use in terms of relaxation is called progressive muscle relaxation. So everybody who's at home following along, if you're sitting, what you can do is I'll take you through kind of this guided muscle tensing and relaxation exercise. So you start with your toes. You clench your toes as hard as you can, and then your feet. Then you move up and start clenching your calf muscles. You continue moving up to your quadriceps and clench those. And then you start slowly moving up your torso, tensing all of your different muscle groups until you get to your shoulders, arms, hands. So you're clenching everything tight, 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 tight. And then you relax it, everything at the same time.
Wow.
So you should feel kind of like an immediate sort of relaxation at the end of that.
Nice. I felt it.
Great. Now, other things that are helpful are going to be exercise. So exercise produces some feel-good neurotransmitters in the brain, endorphins, serotonin, dopamine, norepinephrine. All of those things can be boosted and helped by regular exercise. Now, obviously, some places gyms might not be open. Even just getting out for a brisk walk counts as exercise. Even, doing lifts with your kids, like that
Mhm.
counts as some exercise. Getting moving is really key. The other things that I would say that sometimes, we might not think of as much is we have our daily routines, but sometimes building in rituals is really helpful. So the routine is what you do.
Mhm.
The ritual is how you do it. And if you can infuse some things that you can get pleasure from throughout your day, it might help your mood a little bit. So for example, now I'm not one of these people, but some people feel like part of their morning routine is making their bed. That sets them off on the right path. It makes them feel good. And again, I'm not one of those people, but some people making their bed is something that really is helpful for them.
Uh-huh.
For me personally, my end of the day routine, like my skincare routine, if
Yeah.
I'm able to do that fully, then I feel like I've done, I've had a good day. Uh,
Yes.
so, sometimes taking that extra moment, adding the sugar and spice onto things is something that can be really helpful. Um, Also, during this time, it's really important to stay socially connected with others. It's hard right now with social distancing to feel connected to people, but we have all these great technologies right now that allow us to kind of connect. It's not same, but it's good enough.
Yes.
And that's something also that I'd like to emphasize here is that everybody kind of gets hung up on this idea of perfect, right? We're on social media right now. What does everybody show on social? They're picture perfect family, they're picture perfect everything. And there's this huge pressure to be perfect, right? To do the best that you can, to be the best that you can. And what I want you to encourage yourself to do is to be comfortable with good enough.
Yeah.
So taking that time to recognize that, does it really need to be 100%? Maybe today it doesn't need to be 100%. I think I've done good enough. And that's going to help with some of that anxiety about, getting things done. I'd also like to just kind of close here with saying that sometimes media consumption is actually harmful to your mental health. So if you're noticing that your media consumption, whether that's your Instagram, your Facebook, watching the news, if that's making you more anxious and less happy, then that's something that you should be decreasing your intake of. So for some people, that what that looks like is, say, setting a schedule. So I'm allowing myself to check my Facebook and Instagram once a day, not before I go to sleep, maybe in the afternoon when I'm having my lunch, or maybe watching the news in the morning instead of at night, instead of constantly refreshing these throughout the day. Sometimes, unfortunately, the news can be really depressing and anxiety provoking. So, being aware of those things and being aware of the things around you that are causing you this kind of emotional distress is important.
Thank you very much. Wow. I felt the muscle relaxation and I needed to do this exercise. Thank you so much. I actually have a few questions over here, and it is related what we talked about. It is about dealing with anxiety. So the first question over here is taking time to myself to breathe and decompress. Is that a good option for anxiety? We talked about it.
Yeah, 100%. So one of the things that anxiety does is it makes you feel like this need of immediacy. So like, I have to fix this right now and do it right now, when in fact, the best thing you can do for anxiety is to take a pause and inject some like time in between the thought and the behavior. And then you're going to be able to see things a lot more clear. So sometimes actually taking a break and decompressing, whether that's through, going and taking some deep breaths, walking into another room, going to splash some water in your face, any of those things can be certainly helpful for anxiety.
And that's, yes. In the head, a person asked me, do ice packs helps if you put like on your neck or try to relax using ice packs? Does it help, do you think?
I mean, it certainly can be helpful for some people, especially because it distracts you, right? So you have, because sometimes when you get anxious, you get really hot. And so to cool yourself down, and also it's injecting some time between that anxious thought and like the anxiety, behaviors that we sometimes engage in when we're anxious, because we're interrupting that by going and getting an ice pack, putting it on us, sitting down. So I would say, for some people that might be really helpful as well.
That's good. And one big fear that people write it to me is this negative impact of COVID on mental health. We talked about it, but it did create negative situation in our.
So it definitely has impacted people's mental health. But at the same time, people, and especially kids, are very resilient, right? So my expectation is that as things get better, as more people get the vaccine and things can start to go back to normal, that some of these kind of pandemic linked mental health issues are likely to improve. It might take time. And obviously, if things are linked to people losing their jobs, that might not resolve for some people until they've, gotten back on their feet financially. But, I want to stress that a lot of the anxiety and depression that people are experiencing right now is normal. It's something where, again, if it's really interfering or just stressing for you, then seek help. But many people are feeling, the same way that you probably are. And I would anticipate, though, most people are very resilient, and especially kids, and I'm expecting that people will bounce back.
And talking about kids and mothers, we're going to talk just one more question about homeschooling. There's a lot of moms that doesn't feel prepared to teach their kids, and some moms told me, I'm not gonna make it very well, I'm doing this wrong, I'm gonna make my kid think that I'm a teacher, I'm a terrible teacher. How to deal with this? It was a big part of this year, right?
Yeah, I mean, so moms and some dads really had to wear multiple hats this year. And keep in mind that most of you are not teachers, right? Some of you that very well may be. I mean, then you're juggling teaching and teaching your kids at the same time, teaching your class, teaching your kids. So what I would say is that concept of good enough really applies here. Understanding that you are never going to do it quite as well or as perfect as you would hope, but also understanding that there are some life lessons that you can be teaching your children as well. So a lot of people get really hung up on the academics, right? Because academics are super important, which they are, but then there are also these life skills. And so things like learning how to cook, learning how to take care of a household and run a household, helping, having your kids help you with budgeting, things for older kids. Those are all really important life skills. Even having them figure out how to, a lot of kids nowadays surprisingly don't know how to address or send mail. So even having them write out things, if you're sending, a letter or your holiday cards or whatever it might have been, or whatever you will be sending, I suppose, out, teaching them where the stamp goes. Things like that are important life lessons that are useful. And again, giving yourself just lots of grace. Like, we were all thrown in this. It's not expected that you're going to know how to teach as well as a teacher does. And, if you can, get extra help. See if there's any channels or avenues that you can kind of look to for extra help if you're really struggling with this. There might be some folks in your local area who homeschool full time and might be able to really help in terms of the the big transition it is to homeschooling.
Yes, thank you very much for answering this. And the last question, I thought it was the last one, but this one, I promise you, Dr. Janica, it is, how can I acknowledge my emotions and when is the right time to look for help?
So this is a hard question, because sometimes in the course of day-to-day life, you really, especially for parents out there, you're just trying to keep it together, and you might be, at the end of the day, falling asleep exhausted and thinking, oh gosh, I just have to get through another day. The best analogy I have is actually what flight attendants will say when you're on the plane, right? You have to put your own oxygen mask on first before you're supposed to put it on for your kids. Namely, meaning that if you're not taking good care of yourself, it's going to be really hard for you to take care of your kids. So I think really understanding, yourself and your own struggles and how different things are now compared to your normal, non-COVID functioning, I think that's going to kind of tell you, when to really maybe start seeking help. There are other things, that again, I would say are relatively normal. Like, a lot of people are very anxious about how contagious COVID is, and new wave and this new variant, that's to some degree normal. But if it's something where it's really interfering for things with you, you can't leave the house, you won't let your kids leave the house, even to play outside in the yard, then chances are that level of anxiety has become more problematic for you, more pathological, more clinical. So that's when I would say, it might be time to start seeking help. If it's so excessive that, it's causing problems for you, that's when I would say, it's time to get extra help.
That is so great. Thank you very much for all of your time that you shared over here. Thank you so much with all my heart for accepting this invitation one more time. And I hope we can make another live someday. And I hope you guys stay safe. Please seek help when you need. And if you guys have more questions, send me. And Dr. Janica can answer on her Instagram page. I'm gonna let the information over here as well. And I hope you guys have a good night and a good week. Thank you very much. Bye bye, Dr. Jenica.
Bye bye.